Hello, my name is Jacob. Today I'm going to be doing my Med Push and Piggyback IV skill video using my GPSPs. First I would knock, enter the room, close the door behind me, provide privacy. I'd identify myself to the patient. Hello, my name is Jacob. I'm going to be your nurse today and explain the procedure. Today I'm going to be doing a Med Push on your IV. Is that okay? Once I got permission, yes. I would then ask for 2 patient identifiers. Once I got those and they matched up, everything's good. I would then assess my patient for any allergies. My patient states that they have no known allergies, so I'm good there. At that point, I can then grab a wipe, go ahead and clean my work area, dispose of that, perform hand hygiene, and then I'm going to gather my supplies. At this point, I'm going to do my 3 medication checks. The first one's going to be the MAR as you're against the MAR as you're pulling the medicine out of the Pyxis. The second is going to be against the MAR as you're preparing the medication, and then the third will be against the MAR at the bedside before you give the medication. At this point, I'm going to go ahead and gather all my supplies. You're going to need 3 alcohol wipes for your 3 syringes, 1 for each flush and 1 for your medication. Then you're going to need a 4th one for your Curos cap. At this point, I would then perform hand hygiene. I would also keep in mind my 11 rights to medication administration. I would then, once I put my gloves on, I would then assess my IV site for any complications, any infiltration, and there are none. I would also ask my patient if there had been any previous complications with their IV. They reported none. I would check the medication against their, I would check the MAR also for the prescribed medication before pulling any medication from the Pyxis to begin with. There are 2 locations on the IV that you could use to do your IV push. The first one being the J loop if there's not an IV attached, but since my patient does have an IV attached, I'm going to be using the secondary or the closest hub to the patient to push my meds. At this point, I would go ahead and open up my first alcohol wipe and scrub the hub for approximately 30 seconds. Once that 30 seconds is up, I would then get my first flush out and connect it to the hub. I would pull back until I got blood flash, and then I would push the flush slowly, delivering all 10 cc's. Once that is done, I would then discard that flush, getting my second alcohol swab and scrubbing the hub for approximately 30 seconds. Once that 30 seconds is up, I would then grab my medication, connect it to the hub, and this is when I would do my 3rd check, and I would push it slowly, assessing the IV access site for any infiltration, any complications, anything like that. Also assessing my patient to make sure that they're doing okay with the infusion, and they are. They report no issues. There's no issues with the IV site. I would push slowly at the prescribed rate for the medication until it's all administered. checking the patient the whole time. Are you okay? Yes. Okay. We're almost done. Are you okay? Yeah. Okay. Once that's done, I would dispose of that. I would then open up my my third alcohol wipe, scrubbing the hub for approximately 30 seconds. Once that 30 seconds is up, I would then get my third flush, connecting it to the hub, pushing it slowly at the same rate that I push the medication, making sure to push the full 10 cc's to deliver the full dose of medication to the patient. While assessing the IV access point for any complications and infiltration or anything like that. Also assessing my patient, are you okay? And so on. Once that is done, I would then get my fourth alcohol wipe, scrubbing the hub for approximately 30 seconds. Once that 30 seconds is up, I would then grab a green Kuros cap, capping that port, and assessing my patient for any complications from the infusion, making sure that they're okay, making sure they're comfortable. I would clean up my mess, immediately report or document that I gave the medication, there is no reaction, so on. I would then clean up my mess, make sure that my patient was comfortable. Do hand hygiene, make sure the call out was within reach, go out, report and record, and come back within 15 minutes to assess the patient, make sure that there was no reaction to the medication. At this point, I can go ahead and move into my secondary IV or piggyback. I'm going to go ahead and gather my supplies, get them closer. You're going to need two alcohol wipes, one for your Kuros cap, one for your hub, your tubing, and then your secondary medicine. You're going to check your MAR, and then you're going to check to make sure that your medications are compatible, and they are. So at that point, you would then use your GPSPs. You're going to knock on the door. You're going to enter the room. You're going to use your three checks and 11 rights to med and min. You're going to knock on the door, enter the room, close the door behind you to provide privacy. You're going to introduce yourself to the patient. Hello, my name is Jacob. I'm going to be your nurse today. Today I'm going to be doing a secondary IV, also known as a piggyback. Is that okay? Yes. Once you get permission, you're going to assess for any allergies. Patient notes that they have no known allergies. So you're golden there. You're going to get two patient identifiers. Those match up, so you're good there. At that point, you're going to perform hand hygiene. You're going to assess your IV site to make sure that there's no infiltration, there's no complications. Assess your patient. Ask them if there's been any complications. No, there's not. Okay, so we're good there. At that point, you can go ahead and remove your tubing from the bag and the hanger. I'm going to put my bag over here. At this point, I'm going to go ahead and hang my secondary or my primary bag lower. I'm going to go ahead and open up my secondary bag and my actually first I'm going to make sure that my tubing's closed, and then I'm going to open up my bag and my spike. And spike the bag. Once I know that the tubing is closed, I'm going to fill the canister halfway, checking the site for any infiltration, make sure nothing's wrong. I'm going to take the cap off and open up my tubing to make sure to get all the air bubbles out. At this point, I would then grab my alcohol wipe and scrub the hub for approximately 30 seconds. Once that 30 seconds is up, I would then attach my tubing and set my drip rate to the appropriate drip rate per the order. I would assess my or will come back at periodically throughout the procedure to make sure that my patient was okay, make sure that they weren't having any issues, to assess that the IV site was still good, that there was no issues there, make sure that my patient was tolerating it okay, everything was good there. And once I noticed that the bag was emptied, I would go ahead and disconnect my secondary tubing. Actually, I would make sure that it was closed first, then I would disconnect it. I would dispose of that correctly. I'll get a alcohol wipe, scrub the hub for approximately 30 seconds. Grab a Curo's cap and cap that off. At this point, I would raise my primary bag back up, assess my drip rate on my primary line to make sure that it is appropriate, assess my IV site, make sure that my patient's okay, assess the patient, make sure that they're tolerating everything okay, assess the site to make sure that there's no infiltration, make sure the IV is still usable, clean up my mess, document that I gave the medication fully, that there was no issues with it. Before you remove the tubing, you would obviously make sure that your tubing is closed so you don't lose anything. And your secondary bag would already be closed, so that doesn't. At this point, I would make sure that my patient's comfortable, make sure that their call light's within reach, perform hand hygiene, document, report, and record.